Welcome to the PTRC Area Agency on Aging Family Caregiver Support Program, ARPA Mini Grants, recording number 2. This recording will provide information about the Family Caregiver Support Program, American Rescue Plan Act mini grant available entitled Older Adults as Caregivers of Relative Child. It's more commonly known as grandparents raising grandchildren. In the beginning of 2020, our region, Region G, entered the beginning of a national pandemic that negatively affected older adults and family caregivers. As we begin 2022, we are hopeful that this pandemic can be behind us and that we can begin a national recovery. Family Caregiver Support Program mini grant, older adults as caregivers of a relative child. This request for application for grant proposals is funded by the American Rescue Plan Act of 2021, ARPA. ARPA funds provide a unique opportunity to consider the needs and service delivery that have the potential to respond to the unmet needs of older adults and family caregivers. The Piedmont Triad Regional Council Area Agency on Aging is taking a regional approach in distributing these funds. And they are based on the priorities which were established by the North Carolina Division of Aging and Adult Services. Service match is not required, and the funds will remain available until expended or until September 30th of 2024, whichever comes first. There is additional available information on the PTRC website under the specific Family Caregiver Support Services link at ptrc.org/services/pandemic-recovery-funding-opportunities. The PTRC Area Agency on Aging is making 3 mini grants of $50,000 each available. The goal of the Family Caregiver Support Program is for caregivers to be empowered through education, to be informed of services available to them that can support their own well-being, and to be connected to a support system that can help reduce their levels of stress, social isolation, and caregiver burden. There are specific eligibility requirements for Family Caregiver Support Program respite clients. The client, remember, is the caregiver, and that person can be a person of any age providing unpaid care for an older adult, age 60 or over, or who is providing care to an individual with Alzheimer's disease or a related dementia. It may be a relative caregiver, not a parent, age 55 or older, living with and raising a relative child aged 18 or under, or a relative or parent 55 years or older, living with and raising a disabled adult child aged 19 through 59. Please note that there are special eligibility requirements for respite services under the Family Caregiver Support Act. For these categories, care recipients age 19 and older must meet the definition of frail as specified by the Older Americans Act by being either unable to perform at least 2 activities of daily living, or due to a cognitive impairment or other behaviors, they behave in a manner that poses a significant health hazard or safety hazard to another individual. Services that will be rendered with the ARPA Family Caregiver Support Program funds must meet all Older Americans Act and North Carolina Division of Aging and Adult Services standards and guidance. The 5 categories of services available to support these caregivers through the Title IIIe National Family Caregiver Support Program. The categories listed in the RFA below include some examples. More information is available through the North Carolina Division of Aging and Adult Services Family Caregiver Support Program Manual version 2020. The categories are information, assistance with access to services, caregiver counseling and support groups and training, respite services, and that includes intermittent respite, occasional respite time, and emergency respite. Offering respite services to a caregiver should engage caregivers in the decision-making process about their respite and should be person-centered. The person-centered strategy should be utilized. Respite care can include in-home respite provided in a group setting such as an adult daycare center or caregiver's day out, residential respite provided in a temporary residential setting such as a nursing home or assisted living, or summer camps and after-school programs for older adult relatives as caregivers. Paid caregivers and professional caregivers cannot utilize respite under the Family Caregiver Support Program. For example, a residential care facility cannot be granted funds through the Family Caregiver Support Program to supplement their own human resources and staffing needs. Further, respite is intended to provide intermittent, occasional, or emergency relief to a caregiver. It is not intended to be used as a supplemental payment source for residential facilities. Category 5 is supplemental services, and this includes incontinence supplies, liquid nutrition, assistive technology, personal emergency response systems, handyman yard service, and others as approved by the North Carolina Division of Aging and Adult Services. Other programmatic requirements for the Family Caregiver Support Program include that as of July 1st, 2012, clients receiving Family Caregiver Support Program respite and/or Project Care respite may receive an amount up to a limit of $2,500 in total per fiscal year. No more than 20% of the Family Caregiver Support Program funding may be used for supplemental services. And the APRA Family Caregiver Support Services Older Adults as Relative Caregivers funding also includes a non-unit reimbursement for personal protective equipment and other unique items that allow organizations to protect their staff. But no more than 5% of the total allocations can be spent on PPE and other unique items that allow the organization to provide personal protection against COVID-19. There are reporting and documentation requirements for the Family Caregiver Support Program. At a minimum, the case file client record documentation must include the completed North Carolina Department of Health and Human Services Division of Aging and Adult Services 101 form, more commonly known as the Client Registration Form, a signed consumer contribution policy, a narrative in the case record that indicates why the respite services is needed, documentation of the service type provided and the units provided and reported, including timesheets, fiscal tracking sheets, assurance of confidentiality, documentation that the client is made aware of a grievance and appeals process, and that should be part of their client bill of rights. As a best practice, a completed assessment and subsequent reassessments, copy of the plan of care, signed by the Family Caregiver Support Program representative and the client, a narrative documenting communications and decisions made and progress notes, and a services termination information as appropriate. A cost computation will be required. An accurately completed Family Caregiver Support Program budget form will be required of all ARPA Family Caregiver Support Program award recipients. Reimbursement for this ARPA Family Caregiver Support Program will be handled through the Aging Resources Management System, more commonly known as ARMS, and reimbursement is dependent upon accurate reporting of the services data. All recipients of this mini grant will be monitored. All services provided will be monitored by the PTRC Area Agency on Aging according to a timeline that is established by the North Carolina Division of Aging and Adult Services. and that monitoring will be conducted following the PTRC Area Agency on Aging policies and procedures for monitoring. Confidentiality and security of client records is essential. Client information in any format, whether recorded or not, shall be kept confidential and not disclosed in a form that identifies the person without the informed consent of the person or their legal representative. Community service providers, including subcontractors and vendors, must adhere to all applicable federal, state, and departmental requirements for protecting the security and confidentiality of client information. Record retention and disposition. All community service providers are responsible for maintaining the custody of records and documentation to support the allowable expenditure of funds, service provision, and the reimbursement of services. Service providers must adhere to the approved record retention and disposition schedule posted semi-annually on the website of the North Carolina Department of Health and Human Services Controller's Office. And that may be found on the ncdhhs.gov website. The project period again is May 1st, 2022 through September 30th, 2024. Should be noted that the PTRC Area Agency on Aging reserves the right to reject any or all applications, waive technicalities, and to be the sole judge of suitability of services for their intended use, and further specifically reserves the right to make this award in the best interest of the PTRC Area Agency on Aging Regional Program. The RFA continues with information about submitting an application for the mini grant. You'll note that 3 copies of the request for application with original signatures must be submitted to the PTRC Area Agency on Aging at 1398 Carrollton Crossing Drive, Kernersville. They should be made directed to the attention of Gwen Shields, and they must be received by April 1st, 2022 at 4 p.m. Applications received after that date and time will not be considered for funding. Proposals that best meet the PTRC Area Agency on Aging expectations for service delivery will be selected. Applications will be scored based on their completeness and their description of the intent to provide services. Any questions regarding the RFA must be submitted in writing by March 23rd, 2022 at 4 p.m. to Gwen Shields at PTRC. Her email address is gshields, GSHIELDS @ptrc.org. After such time, after March 23rd, 2022 at 4 p.m., and until such projects are awarded, applicants are prohibited from contacting PTRC Area Agency on Aging staff regarding any issue relating to these funds or to the application process. Failure to respond to the requirements outlined on the RFA or failure to enclose completed copies of the required documents may disqualify the application. The timeline is as follows. The final day to submit questions, again, March 23rd, 2022 at 4 p.m. All applications are due in our office by April the 1st, 2022 at 4 p.m. And announcement of awards will take place during the week of April 25th, 2022. Upon award of the grant, an official budget will be completed using the required form and should be submitted to the Area Agency on Aging. Evaluation criteria. PTRC has developed a scoring tool to evaluate applications. The tool will be available on the PTRC website. And again, proposals that best meet the PTRC Area Agency on Aging expectations for service delivery will be selected. Below, you'll see on the RFA, you will find available funding information, and you will use the following allocations to develop your funding request. Requests must be reasonable, necessary, and justifiable. All funds must be spent on activities related to the ARPA Family Caregiver Support Program Older Relatives as Caregivers mini grant. An organization may submit one application to provide outreach to multiple locations and/or counties. Requested grant amounts, though, cannot exceed $50,000. Please note that no more than 20% of Family Caregiver Support Program funding may be used for supplemental services. Again, award recipients will be monitored for the ARPA Family Caregiver Support Program funds by the PTRC Area Agency on Aging. What follows below is the request for application, and it details that 3 copies again of the request with original signatures must be submitted to the PTRC Area Agency on Aging at 1398 Carrollton Crossing Drive to the attention of Gwen Shields by April 1st, 2022 at 4 p.m. They must be completed with project contact information, including the organization's full legal name, the project director and that director's title, the organization's mailing address, phone number, board chair if applicable, tax ID number, DUNS number, and the type of agency, nonprofit, for-profit, government, other, please specify. Required information also includes a copy of your organization's most recent financial statements, audited or unaudited. For those organizations submitting unaudited financial statements, a completed state grant certification and sworn statement, and a completed schedule of receipts and expenditures are also required. Additional information may also be requested. The next part of the application includes 5 questions. We ask that you complete them to the best of your ability. Word count is not limited, so use the space and any additional space to thoroughly complete those questions. Following that, there is a budget proposal form. Use that following budget request to propose funds needed to support the services that you have described. For example, please be specific. You may include such things as staffing 50 hours at $25 an hour, after school care day respite at $20 per day, $40 per sealed package of diapers. So be as complete as possible. Please also note that this proposed budget proposal will also be followed up with the required Family Caregiver Support Program budget form, and it will be expected that the budget form will reflect the items that you specified on your budget proposal form. No additional items that are not included on that proposal form should appear on the budget form. Below the budget is a bid certification statement. Please read that thoroughly. And then finally is the execution of the request for application to be signed by the authorized person with their title and their date. And please remember also, upon submitting, we will need 3 copies, all with original signatures on them. I encourage everyone to thoroughly read the RFA. This is an overview of it, and I think I covered most of it, but please read the RFA thoroughly. Submit any written questions to Gwen Shields by March 23rd, 2022 at 4 p.m. Thank you.